I'm Angelique Hopkins, and I serve on the WOCIP Board of Directors as the Director of Partnership Development. In my other job, I'm a Senior Director of International Market Insights and Capabilities in the Business Insights and Analytics organization at Bristol Myers Squibb. I was introduced to WOCIP through its founders, Charlotte and Pat. Pat was one of my first managers when I entered the pharma industry, and she is a large part of the reason that I remain in the industry today. In 2018, I attended a BMS-sponsored WOCIP event entitled Don't Take It Personal. After the event, I was so inspired that I immediately contacted Charlotte and Pat to see how I could get involved. 2020 has illuminated 4 major global crises: racial inequality, social injustice, health disparities, and economic disruption, all of which disproportionately affect people of color. There is a great quote from Audre Lorde: "The master's tools will never dismantle the master's house." At WOCIP, we recognized that in order to change the industry, a different mindset was required, and that it was not going to come from our existing systems. And WOCIP was uniquely positioned to drive a change and push for more equality and equity in a different way. Data as king is here to stay, and our increasing reliance on data is raising tough questions about equality and diversity. We cannot forget that in the past, and even currently, healthcare data has been used to disenfranchise, and incorrect conclusions of data have been used to justify decisions in healthcare and treatments that have harmed people of color. As organizations think about big data and using data for decision-making, we have to ensure that our use of data and our decisions are grounded in driving equity, and that data doesn't lead us astray or lead us to make conclusions that harm populations. Companies must build the concepts of equity into their data strategies. They must consider data-driven decisions through the lens of equity and diversity. They must think through how the consequences of those decisions and whether they lead to disproportionate impact of people of color in a harmful way. We must consider the source of our data. If your data is biased, and often healthcare data can be, it will lead you to make data-driven but biased decisions, and those are strategically wrong.